Today I'm going to be modeling how we do an IV insertion and also how we would do an IV push medication. So for starters, I would obviously come, I'd identify my patient, I'd let the patient know what I'm doing, I would make sure that I performed proper hand hygiene. In the case, you can don clean gloves before you palpate for a vein, but in this case, most often we actually try to do it barehanded so that we can actually feel for a vein. So I performed my hand hygiene. I'm then going to open up my IV start kit, and I'm going to first identify the vein that I will be looking for. So in starting an IV insertion, you want to look for a good straight big vein to stabilize your catheter and also to stabilize the size of your needle. In the case today, we're going to be doing a 22 gauge, so I'm going to do a smaller IV insertion. I see that he has a nice pretty vein in his hand. With your tourniquet, you want to make sure that your tourniquet is several inches above the vein that you're going to be sticking, so I'm going to make sure that this is nice and tight. Okay, and then I'm going to palpate. Alright, and now that I've identified the vein that I'm going to stick, I'm going to go ahead and get some gloves on. In this case, we just need clean wall gloves. We don't need, this is not a sterile procedure. The main thing when starting an IV is you want to make sure that you have all your supplies ready. So within your IV start kit, you should have tape to secure. You should have your chlorhexidine for cleaning. Okay, I'm going to go ahead and open my, in this case, when you get gloves on, as you can see, it can be a little bit difficult to get these things open. Y'all get to watch me struggle here. Okay, so I'm going to open that up. Okay, in this case, I always have extra alcohols with me in case I'm doing that. So you also have your extension set. Don't forget your extension set. And this is one thing that you want to have prepped before you start your IV. So I'm going to take and open my flush. I'm going to make sure I prime this. Okay, and I usually will stick mine in here so it's nice and secure before I start my IV. Okay, alright, so I've got my tegaderm, and I've got my chlorhexidine that I'm going to open. Once again, you guys can see you're trying to get these gloves open. Okay. Alright, most of your kit should have one like this. You're going to make sure you squeeze it nice and tight. Okay. Okay. When you guys are starting an IV, make sure that you let that dry. Okay. Before we stick our patient. Okay. Okay. Now I'm going for a superficial vein, so I'm going to barely bend the needle. Once I get blood return, okay, I'm going to advance it just a little bit more. You're going to see different techniques, but you're going to just thread your catheter. I'm going to go ahead and pull my tourniquet, okay, and stabilize that. I've got my extension set ready. I'm going to attach that. Go ahead and make sure my IV is nice and patent. Looks great. You guys know that before you do it, you can also pull back and look for blood return, okay? Once I stabilize that, I need to make sure I go ahead and get my tegaderm on. Okay. The most important part to cover is that insertion side, okay? So I'm going to pull here and then pull. And you guys will see in the hospital, you're going to see some different tegaderms. These ones are not my favorite. Okay. And then we'll pull under here as well. Okay, so that's nice and secure. You can also come and window it with tape just to make sure this is secure, and then make sure that you date it, you time it, you want to put your initials on there so that everybody knows when that IV was started. Okay, so I'm going to go ahead and flush it all the way just to make sure that that's nice and patent. Feel here, make sure it's comfortable for your patient. Okay, and then you will disengage that. Now, if this patient is going to be connected to fluids, at this point we would connect fluids. If they are not going to be, then we will get a nice little security device to put to the end of that to keep that nice and secure, and you want to make sure that you close this, okay? So that is everything that is involved in starting an IV. We are now going to move on to how to actually perform an IV push medication, okay? So, in this case, I'm going to go ahead and draw out my medication. We would have a secure device at the end of this so that it was just to make sure, since I'm going to keep this patient disconnected from fluids, okay? So I'm going to remove all of my things, okay? And I have an order for a 4 milligram, 2 ml dose of Zofran to administer to my patient, this patient has not been connected to fluid, so the step that I would do first is making sure that I have another flush. Flush, please. Okay. If a patient does not have fluids running, one of the things that you will do before performing any kind of push medication, we would do all the same steps that we did earlier. We were going to come in, we're going to talk to our patient, explain what we were doing. We want to make sure that our IV is patent, and to assess for patency, one of the most important things that we'll do is we will connect our flush, okay, and I've disengaged my security device, I've opened up my line. We want to push about 3 to 5 mils in before we give any kind of medication. That way we're ensuring for patency, we're making sure the IV is in the patient, and I'm going to keep that right there while I drop my medication, okay? So I have my blunt needle, and I always grab the smallest syringe that I need to drop my medication. In this case, we're only drawing up 2 mils, so I'm going to grab my 3 mil syringe, okay? And that's just important for safety measures. Always grab the smallest syringe that will hold the medication that you're drawing up. So I'm going to get my blunt tip needle. Now this is a single vial dose, so I do not need to clean off the end of this. I can remove my cap. I'm going to remove the cap. Well, make sure that's on there good. Okay. I'm going to get my blunt tip needle, stick that in, and I'm going to drop all 2 mils. In this case, when you guys are drawing up meds, you can always go up and beyond and make sure you have enough. We're going to come up, go up to that 2 mil mark, okay? In this case, and then we will pull off our needle, okay? Now, because I've had my syringe here, this has safely been still in place, okay? And that's kept the area clean. So I'm going to remove this. Okay. Now the big thing you need to know when you're administering medication is know the proper amount of time in which you administer it, okay, for safety reasons. So I'm going to slowly push my Zofran. You need to keep in mind when you have an extension set, this is part of the reason that after we administer any medication, if they are not hooked up to any fluids, we need to, once again, we need to give them 3 to 5 mils of our flush, okay? So I'm going to reconnect my flush. In this case, this somehow sucked up all of my flush, but I would give them 3 more mils of that, okay? And once they have gotten all of that, I will disengage my flush. And once again, this is open to air, so we're going to put another security device on there to keep that clean, and I'm going to go ahead and close my line, okay? And that is all that is involved in a push medication.